Okay, so let's take a look at our last topic of pediatrics, that is Hodgkin's lymphoma. So how will a child present with Hodgkin's lymphoma? The child will be mostly of age less than 10 years. He will present with lymphadenopathy, which will be painless and firm, and mostly the cervical and supraclavicular lymph nodes are involved, and there will be a mediastinal mass which may cause tracheal compression. And there will also be some constitutional symptoms including fever of more than 38 degrees Celsius, night sweats, and weight loss. And the child may present with allergy or delayed type hypersensitivity reactions. And the extra nodal features include pleural effusion, hepatocellular dysfunction, bone marrow infiltration. So these are the presenting complaints of a child with Hodgkin lymphoma. Now, what are the differential diagnoses of Hodgkin lymphoma? This includes sarcoidosis, lymphocytic lymphoma, and miliary TB. Okay, so what are the important investigations to identify a case of Hodgkin lymphoma? These include blood examinations including CBC, ESR, LFTs, RFTs, serum LDH, serum copper, and ferritin. And this will, you can say, tell the prognosis of the disease if the serum copper and ferritin are increased. Okay, so we also do serum copper and ferritin in a child of Hodgkin lymphoma. So blood examination, then we'll do biopsy of the lymph node, affected lymph node, and the biopsy will show Reed-Sternberg cells. Bone marrow aspiration and biopsy will also be done, and lymph node excision biopsy is preferred. So for biopsy, you can do the lymph node biopsy. You can also do bone marrow aspiration and biopsy, because sometimes the disease or the carcinoma also infiltrates the bone marrow. So in case of Hodgkin lymphoma, we will see the characteristic Reed-Sternberg cells on the biopsy of the lymph node, and mostly we use the lymph node excisional biopsy. Okay, and the imaging techniques can also be helpful, including chest X-ray, CT chest, CT abdomen and neck, PET scan for staging. So biopsy, imaging, and blood examination are the important investigations for Hodgkin lymphoma. And then there is a classification for staging, or you can say identifying the severity of disease in case of Hodgkin lymphoma, and this is called as Ann Arbor classification. And Ann Arbor classification says that if it is stage 1 according to Ann Arbor, then that means that only a single site of lymph nodes is affected. Stage 2 means that more than one site is affected but on the same site. Okay, and stage 3 means that both sides of the abdomen are affected. Basically one side means that only above the diaphragm or only below the diaphragm side is affected. So stage 1 is single site, stage 2 is more than one side but on the same side of diaphragm, and stage 3 is on the both sides of abdomen or the both sides of diaphragm, and stage 4 means that it is a disseminated disease, such that there might be bone marrow infiltration, or you can say liver infiltration or pleural effusion. So yeah, that are some of the important points regarding Hodgkin lymphoma. I hope it was helpful, and by now we are done with all the important topics of pediatrics.